I'm going to give you a chiropractic narration x-ray report. So I'm going to tell you this person's story just solely on the x-ray alone. In fact, the only information we're given is that she's a 41-year-old female who came in struggling with severe vertigo or dizziness. Now, before I show you her x-ray, I want to show you what normal looks like. This is a normal side or lateral view of the neck or cervical spine. And there's three things that make this normal. Number one, it has that nice C shape or lordotic curvature. Two, the discs are nice and thick. And three, the vertebrae are nice and square. This is the way it should look. This, on the other hand, is her. Now, the first thing you should notice is that there is no cervical curve. In fact, I'm going to put the annotations in so you can see what the point I'm trying to make. The yellow line is where she should be. The red line is where she's at. This is a complete reversal. And this is, in a way, the worst situation to be in because biomechanically, it is the exact opposite of the way it should be, which causes this to wear and break down at a very accelerated pace. Now, at first, somebody may think, wow, she must have had a severe whiplash car accident. And I can see why someone would quickly think that, but that's not what's going on in this case. When I zoom in and I look at C4, 5, and 6, where these arrows are pointing at, what I see is arthritic bone spurring, degeneration of the intervertebral discs. Everything is starting to break down. In fact, she's what we call phase 2 degeneration, which predates this injury in her middle neck 30 years ago. In fact, this happened when she was around 11 years old, give or take 5 years. So now I'm thinking fall off a balance beam, fall off a skateboard, fall off a bike. Something happened to her in her early child years. And for the most part of her life, she didn't struggle with any symptoms because symptoms are almost always the last thing that shows up. But over the last 5 or 6 years, this patient has been struggling with severe neck pain, headaches, vertigo, we knew that, possibly even tinnitus or ringing in the ear, shoulder pain, numbness and tingling in the hands. And all these symptoms almost certainly become daily, chronic. She's struggling with them all the time. It's affecting her work. She's now getting frustrated. She feels much older than her biological age. And almost certainly she's taking medications daily to try to mask the symptoms that she struggles with.